Recent workplace attacks on nurses have advocates calling for change.
The Kentucky Nurses Association says that there needs to be more workplace training for nurses and more protection. Wave News reporter David Mattingly finds patient care could also be affected.
Myra, the Kentucky Nurses Association points to 3 acts of violence across the state that left nurses injured since the beginning of the year. One of those happened the morning of April 12th here outside of Jewish Hospital.
Police arrested 34-year-old Lacey Wilson and charged her with assault after she allegedly attacked a uniformed nurse leaving Jewish Hospital early on a Saturday morning. According to the police report, Wilson then pulled out a sharp object and began stabbing the nurse in the back. Advocates for nurse safety say the case is part of an alarming trend.
1 in 5 healthcare worker is assaulted. Nurses are assaulted more than policemen.
In a statement, the Kentucky Nurses Association expressed outrage that this kind of violence against healthcare workers continues to occur. CEO Deliner Manson calls for more reporting and more training for violence in the workplace.
It's every place a healthcare worker works. Home care, hospice care, long-term care. I had a nurse email me about being punched by a patient in long-term care. It's not just hospitals.
I've been punched, I've been spit at, I've been yelled at.
Renee Cecil speaks from experience as a longtime emergency room nurse. She worries that violence has become a factor in nurses leaving the profession.
Nurses don't deserve to come to work and feel threatened. And I'm really concerned. We're already in a crisis for staffing now. And nurses are thinking about leaving the field because they don't feel safe to show up at work.
In 2023, the state legislature required healthcare facilities to conduct violence risk assessments and create a workplace safety plan. Sponsor Jason Nemish released a statement after the recent stabbing, saying in part, this recent incident highlights the need for all healthcare facilities to follow both the spirit and the letter of the law.
And responding to our questions, U of L Health says they comply with all state laws. We were also told that security was on duty when the nurse was attacked and that escorts were available. Since then, added security has been brought into play here. The nurse was treated and released the same day. Reporting live, David Mattingly, Wave News.